Hi, my name is Jessica and I'll be your nurse for today. I'm just gonna close this so we have some privacy. Okay, there we go. And alright, make sure we're nice and clean to begin our exam. I'm just gonna start with a couple of questions. Can you tell me your name?
Kate Livo.
Kate Livo, and can you tell me where we are?
We are at SUNY Downstate.
Okay, and can you tell me the date?
It is July 1st, 2017.
It's July 1st. Oh. And why are we here?
We're here to do a practice student assessment.
Okay, awesome. Alright. I'm just going to actually do an eye assessment first. So we're going to just check for some constriction of your pupils, alright? I'm going to flash this in your eye twice to check for. Okay, great. I'm going to check for consensual. Great. For direct. Right. And then opposite eye for consensual. Good. With constricted, probably about 3 to 2 millimeters, which is exactly what we want. So now what I'm going to have you do is I'm going to have you follow my finger, this one, okay?
Okay.
With your eyes, do not move your head. Very good. Okay, follow my finger. Checking for accommodation. Very good. Now, what I'm going to have you do is I'm going to have you read this paper here. So just read the top line.
Okay. Active learning template, system disorder.
Perfect. Only about 14 inches away. Good. Now, read the second line of that sign over there.
FP.
Perfect. Now what I'm going to do is I'm going to put my hands up top of your head. You're not going to see them, and then you're going to let me know when you do see them, okay?
Okay. I see them. I see them.
Good. That was symmetrical.
Yep. Yep.
Good. Underneath.
Yep. Yep.
Okay. Just going to document some of my findings. Great. So now I'm going to do a whisper test, okay?
Okay.
So I'm going to have you close this ear.
Okay. Pencil.
Very good. Close the other ear, please.
Paper.
Very good. All right. Now I'm going to do a little sharp, dull, fun.
Okay.
So what we're going to do is you're going to let me know when you feel the sharp and when you feel the dull. Okay? I'm going to do that on your hands and legs. All right.
Let me close my eyes?
Yes, close your eyes. Okay.
Sharp. 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 Dull. Sharp. Dull. Dull.
Very good.
Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp.
Very good. Got all those correct. Okay, so now I'm going to check your facial expressions.
Okay.
I'm just going to check for symmetry as you move your face. So smile for me. Beautiful. Raise your eyebrows. Great. Very good. Take direction very well. So great. So now I'm going to actually check your mouth. So I'm going to take my little tongue depressor, my makeshift tongue depressor, and I'm gonna just, if you don't mind, can you actually pull your cheeks down so I can see your teeth and your gums, and do that on the upper side as well? Great. Looks great. So I'm gonna just have you, sorry, I'm just trying to keep this sanitary. Can you open your mouth for me? Okay, good. Can you stick out your tongue and move from side to side? Great. Now I'm going to put this into your mouth. We're going to check out your tonsils and your uvula. Can you say ah for me? And I see the tonsils. They're about toothless. Great. Okay. And your mouth. I'm just going to. Oh. Okay. And I see there's a gag reflex. Yeah, very good. Okay. Great. So everything looked so I'm gonna check your respiration. If you don't mind, we're gonna just take this off, and I'm going to just put this in front of you.
Okay.
I'm gonna come up behind you, and I'm gonna do your respiration. Okay?
Would it be helpful for me to lift this?
Yes, it would.
Okay.
So I'll help you out there a little bit. Okay, great. So when I put the stethoscope on you, you're gonna take a deep breath for me, okay?
Okay.
Okay, I cleaned the stethoscope before when I walked into the room. Okay. I'm gonna do it right into your armpit. I'm gonna kind of get in there, so. Okay, to the other side. Great. Are you okay?
Yeah.
Okay. Last one. Beautiful. I didn't hear any adventitious lung sounds. Actually, I'm going to check for thoracic expansion as I'm back here. So I'm going to just have you just neutral for a second, and then take a deep breath, hold it, and let it go. Great. Good. Symmetrical expansion on both sides is what we were looking for. So I'm going to take this off of you. We can just, you're going to do your front side. All right. So we're same thing, okay?
Okay.
I'm just going to move this, if you don't mind.
Okay.
And just go in front of it. Okay. Beautiful. Okay, great. So now I'm actually gonna have you lay down.
Okay.
We're going to just do a skin assessment.
Okay.
So, yeah. I'm just gonna move this up if you don't mind. What we'll do is we'll cover you for one side. Okay, great. Got some macules on both sides. Have you noticed any change in your, okay? There's no pallor, looks to be a uniform color. Okay. And let's see, we're just gonna test you for turgor, so. Okay, instantaneous. And let's see what else we got here. Oh yes, and let's check your temperature. Yep, here's warm. A little cooler at your, little cold at your extremities, but that's fine. Okay. And yeah, there's no pallor. You look like you have good moisture. I'm going to actually check for your heart sounds now, okay?
Okay.
Okay. Is this okay?
Yes.
All right. aortic. Now this is your pulmonary valve I'm checking. And right underneath. Okay. I'm just gonna lift this up if that's okay.
Yeah, of course.
Checking here. Tricuspid. And now mitral. Okay. Good. Regular rhythm. Good amplitude. So I'm gonna check for your actual pulse. We're gonna take your apical pulse. Great. Got 78 for your pulse and 16 for your respiration. Those are all within the normal ranges, so that's good. I'm going to check for the rest of your pulses on your body, so I'm going to be kind of prodding you a little bit, if that's okay.
Sure.
Okay. It's a nice strong one. Now, I'm going to do your femoral, so I'm going to... Okay, sorry. I feel it. Okay. Popliteal. This one's a little bit of a harder one to find. Okay. And there we go. Okay. There we go. Alright, so all of your pulses are there and normal, not 2+. So now what we will do is I'm going to check you for capillary refill. 2, 3. Check both sides. Okay, that was probably about 3 and 3 for both sides. Now I'm going to check you for edema. I don't see any signs of edema, but we're going to press down for 5 seconds. See if there's no pitting. Run my finger actually check a better place. I'll check here. 5. Okay. Alright, great. So there's no pitting. So yeah, I'm gonna have you just one more thing. I'm gonna check for pushback. Are you feeling any pain?
No.
Okay, that was helmet sign. Okay, great. You can sit up. Okay. And I'm sorry, lay down again.
Okay.
Sorry about that. I'm just gonna check your stomach. Okay. Looks like there's symmetry. And I'm gonna check your abdomen for some vowel sounds. Alright. There's about 3 vowel sounds in that. There's 2. There's 3. There was 4 in that one. Good. All within normal range. Just gonna write those down. Okay. Do you feel any pain?
No.
So no tenderness or masses. Okay, great. So now I'm going to do your history. Can you lift up against my, okay, push down, push in, push out, push down, push up, okay, push down, push up. Alright, can you squeeze my fingers? Sorry. Can you squeeze your fingers out? Very good. Alright, I'm gonna do your legs. Can you push up? Can you push up? Good. Push down. Okay, push in. Push out. Okay. Push down. Push up. Okay. Push back. Push forward. Okay, great. Now you can stand. You can sit up. Okay. Push up. Okay, great. I'm gonna test you for range of motion. Ready? Oh yeah. Also, I want you to turn your head. Turn your head. All right, that's good. I'm gonna test it for range of motion. Ready? Follow my lead. Cross. Circular. There you go. Can you do this standing up? Is that okay?
Yeah.
Okay. Out. Up. Down. Up. Out. Up. Down. Okay, great. Now I'm gonna have you walk to the. And that's good. Great.